I hope the slides are now visible to everybody. Kindly someone tell me that the slides are visible for me to continue.
Wakazi, the slides are visible and I bet you should go on. Thank you.
Yeah, so this is the topic, health and psychosocial ramification of Muguka. And at large, the entire cut, Mira and Muguka. My presentation outline will include a brief background in line with the global data and trends coming to Kenya and Mombasa as a county. What are the classification of Muguka in line with the cut differences of Muguka and Mira? Most of us understand that all these are classified under cut, and we have Mira and we have Muguka. What are the health effects of Muguka? What are the psychological effects of Muguka and Mira? What are the social effects of Muguka? And what is the way we discuss a few items based on the slides. Starting with the background, the prevalence of alcohol, drug, and substance abuse has markedly increased over the last few decades in Kenya. The coastal region, particularly Mombasa County, has documented evidence of drug use since 1980s. The region has been battling the menace of hard drug, especially heroin and cocaine and other opioids that have strongly been associated with the burden of negative health, socioeconomic consequences, and health harm that lead to increased disease burden, e.g. HIV. However, in recent few years, studies have shown that there is increase in the use of cut, basically Mira and Muguka, and to narrow down, this is basically Muguka in the coastal region. This is backed by a survey that was conducted by NACADA in 2022, which shows that cut, Mira, and Muguka was the third most abused drug in Kenya, with a prevalence of about 3.6, the highest being alcohol and tobacco. For this, it is estimated in that study that 1 in every 28 Kenyans aged between 15 to 65 years who are currently using cut. In terms of gender, 1 in every 14 males and 1 in every 143 males. The data now from Mombasa County, the data from civil society organization, that is MEWA, Health and Harm Reduction, and Reach Out Center Trust, data from Mental Health Hospital, Portrees, Sub-County Hospital, and Post General Teaching and Referral Hospital, and private mental health institution, mostly data from Mamamina, indicated that there's increase in mental conditions attributed to the use of Muguka. Subsequently, there's increase in use of Muguka by underage. This was further indicated in NACADA 2022 survey, whereby the age of initiation of Muguka was at about 9 years. When you go to drug classification of Muguka, what is Muguka? So Muguka is classified under cut. In cut, we have Muguka and Mira, both classified as one compound, scientifically known as Catha edulis. It is a plant mostly grown in Eastern Africa and Arabian Peninsula. Cut, both Muguka and Mira, they basically have two psychoactive ingredients, which is cathin and cathinone. Cathinone has a structural and pharmacological similarity with amphetamine. That's called natural amphetamine. I'll talk more about amphetamine or about cathinone so that we can understand what is this cathinone and understand the magnitude of it. World Health Organization classified cathinone as a drug of abuse since 1980s, but its legality varies by region and by country. This is the chemical structure of cathinone and cathin and amphetamine. Just look at the similarity, the way they are so close to each other. We all know about amphetamine, which is a non-stimulant. What is cathinone? For just our own understanding, cathinone is a stimulant. Most of the time, it is lab-made. An example is of synthetic cathinone is bath salt. It is illicit synthetic cathinone use can be life-threatening. Illicit synthetic cathinone use can be life-threatening. They can cause health problems, and they can lead to stimulant use disorder. There's a drug that is called bupropion, which is a derivative of cathinone, which is used for the treatment of depression and smoking cessation. Pharmacokinetic, what does the drug does to the body, human body? Caffeine and cathinone are absorbed through the mucous membrane of the mouth and subsequently the lining of the stomach. Euphoric effect is within an hour with peak plasma concentration of cathinone attained in about 2 hours. So this is something that works very rapid. Within an hour, there's an effect, and within 2 hours, there's peak plasma concentration. Very, very fast. The elimination half-life is about 4 hours. All or most of the cathinone is rapidly metabolized to norepinephrine and caffeine. The major metabolite of norepinephrine is norepinephrine, with small caffeine being minor metabolite. Only less than 7% of cathinone is excreted and changed in the urine. Let's note this. 93% is changed by the body to norepinephrine and other chemical components. Caffeine and norepinephrine are slowly absorbed and then excreted mainly in unchanged form within about 24 hours. In terms of drug classification, continuation, we look at legality of caffeine and cathinone, which is the main component of Muguka and the Mira. In the USA, Muguka and Mira use is illegal. Cathinone, because cathinone and caffeine are classified as Schedule 1 and Schedule 4 drug under Controlled Substance Act. In North America, Europe, most countries such as Egypt, Eritrea, Tanzania, and Saudi Arabia, cat importation, distribution, and use is totally banned. However, when you come back to Kenya, cathinone and caffeine, let's understand this, cathinone and caffeine, which is the main component, are classified and prohibited under the Narcotic Drug and Psychotropic Substance Act, Cap 245 of 1994. In this cap, it has been divided into 3 schedules. First schedule is a list of narcotic drugs. Second schedule is a list of psychotropic substance, whereby caffeine and cathinone is included in second schedule. Third schedule comprises of a list of prohibited plants. An example of that is a plant like cannabis. However, we need to note that cat is not included in this third schedule. Just for our own understanding, for participants who probably have not encountered these two, Mira is looking like what is being seen in this picture. And Muguka, these are leaves that are like what is being seen in this picture. So what is the difference between the two varieties? What is the difference between Mira and Muguka? Mira, both of them are crops. One is a tree and one is a shrub, very small tree. Mira is a tree, while Muguka is a shrub. Mira has low concentration of caffeine and cathinone, while Muguka has high concentration of caffeine and cathinone. Very few leaves will give you a very big, high concentration or plasma concentration of caffeine and cathinone. Users of Mira chew branches, while users of Muguka chew leaves. The cost of Mira is high compared to the cost of Muguka. This leads to easily availability of Muguka and the product being so cheap. Mira is harvested in 6 months, while Muguka, it is harvested within 3 months. Mira has less concentration of pesticides in it, while Muguka has higher concentration of pesticides in it. I'll have a whole slides to explain why am I talking about pesticides being in Mira and in Muguka. So the question that I'm posing to you participants, is cat, both Mira and Muguka, a drug or a cash crop?
Yeah, the floor is open. Anyone who wants to answer can just raise their hands and give an answer.
Okay, Caro.
From the chat, I can see someone. From the chat, I can see one Eileen Mwakluma has said that it's a drug. Same to Monica Mudanga. Mary Kaburi has said that it's both. Jafet Musiko has said it's a drug. And I can see Halima Mwanguta has also said it's a drug.